Gentlemen, let's talk honestly about something that affects almost all men after 50. It's a topic that's rarely discussed out loud, but one that's thought about very often. Performance, endurance, and that quiet confidence in knowing your body responds exactly when it should. Maybe you've noticed that everything starts to work more slowly. Firmness isn't the same as before. Small urination problems appear, or chronic lower back pains that simply won't go away. Many men come to the conclusion that it's just the price of aging and that they have to resign themselves to it. But what if I told you that this decline in performance is absolutely not an inevitable fate dictated solely by age? What if the real cause wasn't the number of years, but a simple mechanical blockage at the center of your body neglected for decades? There is a very precise point, a powerful pressure point, that massaging for just 60 seconds a day can reopen this system and restore natural balance. It's a technique that improves blood circulation throughout the pelvic region, releases the nerves responsible for the response, and at the same time reduces deep muscle tensions. The result is better comfort, better sensations, and the gradual return of what many already considered lost. I know it sounds too simple. You might think it's just another strange trend without real foundation. That's precisely why I want you to know one thing. This point has been known for thousands of years in traditional medicine and has always been considered the center of masculine vitality. Today, modern neurology and physiotherapy are starting to explain why it really works. My name is Dr. Sophie Laurent, and in a moment, I'll guide you step by step through this process. I'll show you exactly where this point is and why it's so crucially important. But before we get to the technique itself, you need to understand one essential thing. What most men describe as a sudden decline in performance is almost never truly sudden. It's a silent process that develops over years without you realizing it. It's not a flaw that appears overnight. It's a congestion at the most important crossroads in your body. In my office, I meet men who tell me, "Doctor, just a few years ago, everything was fine, and now I feel like something is blocked." And that's exactly it. The problem isn't a lack of desire or age. The problem is a mechanical blockage that forms at a key spot in the pelvis. When the quality of erection, its stability, or sensations decrease, we're almost always dealing with a combination of three factors. And these three factors converge precisely at the point I'm going to teach you to massage. The first factor is blood circulation. An erection is largely a matter of blood flow. The tissue responsible for firmness works like a sponge. It needs to fill quickly and abundantly with blood. The problem, however, is that this blood is delivered through arteries that pass through the pelvis. Years of sedentary lifestyle, stress, and inflammatory processes make these vessels rigid and less elastic. Blood flow slows, blood stagnates, and the body's response is no longer immediate. The second factor concerns the pelvic floor, muscles. They control the bladder, intestines, and sexual functions. The paradox of modern man is that these muscles are both tense and weakened. Chronic contraction, stress, and poor posture keep them in a permanent state of tension. A muscle that's contracted like this literally compresses the blood vessels and nerves, interrupting the signal precisely when it's most needed. The third factor is neurological. The pudendal nerve is responsible for sensations and triggering the response. When it's compressed by tense muscles, the signal becomes weak and delayed. First, sensitivity decreases, then self-confidence crumbles, and finally, frustration and psychological tension appear. In summary, your vitality hasn't disappeared. It's trapped behind a barrier made of rigid vessels, contracted muscles, and compressed nerves. The point we're talking about acts like a safety valve for these three systems at once. That's why just 1 minute a day can have such a profound effect. Allow me now to introduce myself briefly and explain why I insist so much on the importance of this simple technique. My name is Dr. Sophie Laurent. For many years, I have worked with men who don't come to see me just for a prescription, but mainly in search of an answer to an essential question. Why doesn't their body function like it used to? For a long time, medicine focused on suppressing symptoms, a pill for the present moment, a quick fix for one night short-term help. But thousands of conversations with my patients have taught me one thing. This approach doesn't solve the real problem. It just masks it. Most of the men sitting across from me in my office say the same thing. They no longer feel like themselves. They're tired, frustrated, and feel like their body is slowly slipping away from them. And I always respond the same way. You're not a broken machine. You're a complex system that hasn't been properly maintained for years. The decline in performance is neither a mystery nor a whim of biology. It's an anatomical problem that requires an anatomical solution. That's why in my work, I don't rely solely on Western urology, but also on knowledge from physiotherapy and traditional medicine systems. These disciplines have long understood something that modern medicine often overlooks. The body functions as a whole. Tension in the hip flexors affects the lower back. Tension in the lower back directly impacts the pelvic floor. The pelvic floor is directly linked to your performance, sensations, and control. This massage technique isn't my invention. It's ancient knowledge now confirmed by modern physiology. I recommend it to my patients not as a substitute for medical treatment, but as the basis for daily prevention. It's a way to stop being a passive passenger and become the co-pilot of your own health. 1 minute a day, regularly, without pressure or fear, can over time bring back what seemed lost. Now that you understand why this method makes sense, it's time to get to the concrete point. Before showing you the exact location and the technique itself, we need to talk about the most common mistakes that cause men to give up too soon and see no results. Before explaining the precise point and technique, we need to pause on something very important. I've seen too many men start with hope and give up after a few days. Not because the method didn't work, but because they kept repeating the same mistakes. The first mistake is using too much force instead of precision. Many men think that the stronger the pressure, the better the results. That's understandable, but in this specific case, it's completely wrong. This area is highly innervated and richly vascularized. Too much pressure doesn't promote relaxation. On the contrary, it causes microlesions, inflammation, and additional pressure on the nerves. If after the massage you feel pain, burning, or radiating sensations, it's a sign that you forced it. The correct pressure should be firm but soothing, noticeable without ever being painful. The second mistake is massaging without oil or with an unsuitable product. Oil isn't just an accessory, it's an integral part of the therapy. Dry massage creates friction and skin irritations instead of reaching the deep layers. Conversely, heavy synthetic products can clog pores and reduce effectiveness. A well-chosen oil acts as a carrier that allows the massage to reach deep where it's really needed. The third mistake is lack of regularity. Massaging for 3 or 4 days and then stopping because nothing spectacular happened. Remember, we're trying to reverse years of tension, stagnation, and bad habits. This can't be fixed in a single attempt. The first subtle changes usually appear after about a week, and more noticeable effects after several weeks. It's a process, not a trick. The fourth mistake is an uncomfortable position. If you perform the massage in a tense, twisted posture with your wrists strained, your body automatically goes into defense mode. The muscles that should relax contract even more. The technique must be done in a comfortable, stable, and calm position. Otherwise, you're fighting against your body instead of working with it. The fifth mistake is treating the massage only as preparation for a specific moment. If you only practice it right before planned intimacy, it creates pressure and stress. And stress immediately blocks blood circulation. This practice should be a daily care routine, like brushing your teeth, not a performance test. Only then does the body respond naturally without tension or excessive expectations. If you avoid these mistakes, 1 minute a day will truly start working in your favor. You're now ready for the next step. We're getting to the most important element. When this point is correctly located, the whole technique acts like a perfectly fitted key in a lock. If it's not found, the effect remains weak or disappears completely. This area is called the perineum. In traditional Eastern medicine, it's known as the Huiyin point, the center where the main channels of masculine vitality converge. From an anatomical perspective, it's where the essential blood vessels, nerves, and pelvic floor muscles meet. How to find it concretely. Imagine a straight line between the base of the scrotum and the end of the spine. That is the coccyx. Exactly in the middle of this line is a soft, fleshy area. It's neither bone nor a hard structure, but soft and elastic tissue. When you apply light pressure with your finger on this center, you'll notice something characteristic. One spot will be noticeably more sensitive than the rest. Not like sharp pain, but pressure sensitivity. As if the body is saying, "This is where the tension is stored." That's a very good sign. It means you've precisely found the place where years of blood stagnation and muscle tensions have accumulated. This point is directly above the bulbospongiosus and ischiocavernosus muscles. These are the ones responsible for firmness, control, and the power of the response. It's also here that the internal pudendal artery penetrates deep into the pelvis to irrigate the tissues responsible for performance. With a single gesture, you're acting simultaneously on blood circulation, musculature, and nerves. If everything is clear so far, in the next section, I'll show you very precisely what the complete 60-second massage technique looks like, step by step, without assumptions, without confusion, in a very concrete way. We're now at the heart of the matter. Here is the complete 1-minute protocol that I recommend to my patients. There's no need to modify or improvise it. Just execute it exactly as I describe. Start by preparing your position. The safest and most effective position is lying on your back, knees bent, and feet flat on the floor. In this posture, the hips and pelvic floor relax naturally. An alternative is sitting on the front edge of a stable chair, feet flat on the floor and knees slightly apart. Choose the position where you feel most comfortable. The first 5 seconds are for preparation. Apply a small amount of warm oil to your fingers and the entire perineal area. Don't rush. The warmth and contact already send a safety signal to the nervous system. The next 5 seconds are for testing the pressure. Place your middle finger or 2 fingers on the identified point. Apply pressure comparable to that on a ripe tomato, firm enough for the tissue to yield slightly, but gentle enough to cause no pain. Breathe in slowly and deeply. The next 30 seconds consist of circular movements. Maintain the same pressure and make very small, slow circles. 15 seconds clockwise, then 15 seconds counterclockwise. Imagine this movement eliminating stagnation and drawing fresh, oxygen-rich blood to the tissues. Don't speed up. This isn't a strength exercise. Next come 20 seconds of alternating pressure and release. Press on the point while calmly counting to 5. Then completely release the pressure for the next 5 seconds. Repeat this cycle 2 or 3 times. This phase is essential for releasing compressed nerves and deep tension points in the pelvic floor muscles. The last 5 seconds are for conclusion. Remove your fingers and take a very slow, deep breath, inflating your belly. Then exhale calmly. This way, you consolidate the state of relaxation and regeneration. There you have it, 1 minute without pain, without haste, without strain. In the next section, I'll explain which oil to use and why. It has crucial importance for the results. At this stage, many men make the mistake of thinking oil is just a simple lubricant. That's not the case. Oil is an active element of the therapy. It determines whether the massage stays superficial or penetrates deeply, where the problem really is. The first option, the simplest, is castor oil. Biologically, it's remarkable because it contains a very high concentration of ricinoleic acid, known for its powerful anti-inflammatory properties and its ability to penetrate deep tissue layers. In practice, this means better local blood circulation and reduced vascular rigidity. For many of my patients, it's the best choice to start with. It's simply essential that it's high-quality cold-pressed oil. The second option is black seed oil, Nigella. I recommend it to men who want to go a bit further. Black seed oil has been used for centuries in Middle Eastern medicine to support masculine vitality. It contains active compounds that promote blood circulation and help reduce chronic inflammation. Many men report after using it a pleasant sensation of warmth and deeper relaxation throughout the pelvic region. The third possibility is a blend. You can combine castor oil and coconut oil in equal parts. Coconut oil improves glide and has natural skin protective properties. To this base, you can add a few drops of essential oil, such as rosemary or peppermint. Rosemary stimulates blood circulation, while peppermint provides a cooling sensation and signals blood vessels to dilate. Always remember that essential oils must be strongly diluted. Never apply them pure directly to the skin in this area. A well-chosen oil allows the massage to go beyond a simple mechanical gesture and become a deep therapeutic application. That's the difference between a fleeting feeling of relief and a real effect on blood circulation, nerves, and musculature. In the next step, I'll show you how to enhance the effects of this minute with simple habits that further open the pelvic region and accelerate results. I want you to not see this daily minute as a trick or a last-minute solution, but as an act of respect toward yourself. The decline in performance isn't just a physical issue. It's a silent emotional burden. Avoiding intimacy, fear of failure, loss of that quiet confidence that everything works as it should. When you consciously relax this central pelvic point every day, you're doing more than massaging. You're removing a mechanical blockage that for years has restricted blood circulation, compressed nerves, and kept muscles in permanent tension. And when this stagnation starts to dissipate, the effects aren't limited to one area of life. Better bladder control, less stiffness in the hips and lower back, more peaceful sleep, greater freedom of movement. All these are signs that the body is starting to work with you again. You have a choice to make. You can accept the idea that from a certain age, everything inevitably deteriorates and that the only response is costly, temporary solutions. Or you can choose the path of conscious action. 1 minute a day, a simple technique, a bit of patience and regularity. It's a minimal investment compared to what you can regain. As Dr. Sophie Laurent, I've accompanied many men who thought their best years were behind them and who then discovered that their body had never abandoned them. It was just waiting for someone to finally remove the blockage. Your vitality hasn't disappeared. It's still there, you just need to send it the right signal day after day. Yeah,